Hello friends, my name is Dr. Jatin Ahuja. I am a senior consultant infectious diseases in Indraprastha Apollo Hospital, New Delhi. Today I will be discussing about HIV or AIDS condition. What is HIV? HIV is a viral disease in which body immunity goes down, leading to multiple bacterial, fungal, tuberculosis or viral infections. What is AIDS? AIDS is acquired immunodeficiency syndrome. It is considered to be the final stage of HIV in which body immunity is minimal and body has multiple bacterial infections, fungal infections, tuberculosis disease, or it could be parasitic diseases. What are the symptoms of HIV? Patient with HIV may be asymptomatic in the initial stages of acquiring the HIV. However, with the passage of time, when patient is not put on ART therapy, which is antiretroviral therapy, which we give for the HIV patient, body immunity keeps on declining and patient may have fever, weight loss, swollen glands over the neck, over the armpits, and sometimes long lasting diarrhea. Again, if patient still at this point of time also patient not put on the treatment, he may have underlying a chronic infection in form of any organ involvement. It could be brain, it could be lung, it could be any other body system. So, how quickly do patients with HIV develop AIDS? Patients whenever get infected with the HIV, the virus start multiplicating. However, at this stage patient may be asymptomatic or he may or she may develop the acute HIV syndrome, which could be a prodromal symptoms like any other viral diseases like fever and sore throat. Later on, this HIV become a latent phase or a phase of a window period in which patient is asymptomatic totally and he or she may not have any symptoms. However, if with the passage of time his or her CD4 declines, he may land up in the stage of a chronic HIV disease. At this stage, usually most of the patients get diagnosed with the HIV and started their treatment. Even at this stage, those who don't start their treatment, they land up in the stage of a AIDS, which usually takes around 10 years, varies from body to body. When is HIV diagnosed? So HIV usually get diagnosed in most of the patients when they started throwing their symptoms, either in the form of a fever, in the form of weight loss, cough or night sweats. In this condition, patient usually visits their primary physician and got to be tested with the HIV. However, there are few patients who are donating their blood on regular basis and sometimes they get caught in the form of a HIV positivity in the routine testing for the blood donation. What are the stages of HIV? HIV virus when enters into the body, it's divided into various phases or divisions. In early stage, it leads to the acute HIV infection or acute HIV syndrome. In this phase, patient may have the prodromal symptoms like fever, cough, swollen glands. Then there is a phase of a asymptomatic or latent phase, which can vary from 1 year to 5 years, in which patient is totally asymptomatic and he or she may not have any symptoms. Then comes the phase of a chronic disease where patient body having the multiple infections from the oral thrush or fungal infection to body skin infections, or it could be loose motion, dry cough or fever. The last stage is known as the stage of AIDS, that is acquired immunodeficiency syndrome. In this phase, patient body immunity goes to the 0 level and patient may have the multiple infections and significant weight loss. How can HIV be transmitted? There are 4 ways of HIV transmission. Number 1, that is through sexual contact. Whenever we have the unprotected intercourse or there is a high risk activity or we are having the multiple sexual partners. That can be a potential reason for the HIV transmission. Other second important reason is mother to child. When mother is HIV positive and she is not taking the medication, she can transfer the virus from her to the child. Third common reason is sharing the needles or tattooing. That can lead to the HIV transmission, especially if the needles are infected. The fourth one is through the blood transfusion. How long after getting HIV you can pass it on? So, as you acquire the HIV, you can transmit the virus from one of your partner. It could be asymptomatic phase or it could be a symptomatic phase. What are the 5 things you can do to protect yourself from getting the HIV? Number 1, practice safe sex. Use protection whenever necessary. Number 2, avoid using or sharing the needles. It could be a potential HIV transmission route. Number 3, avoid having the multiple sexual partners or engaging in high-risk sexual activity. Number 4, PrEP, that is pre-exposure prophylaxis. PrEP can be taken by a HIV negative person who are engaging in multiple partners or high-risk activity after consulting with their primary physician. Number 5th, post-exposure prophylaxis. Whenever patient getting exposed with unknown partner or with unprotected intercourse or with protection getting burst, there is a chance to prevent HIV through PrEP route. It is to be started within 72 hours of exposure. Is there a treatment for HIV or AIDS? Yes, we do have the treatment of HIV or AIDS. Patients who present with HIV or AIDS, they are put on the antiretroviral therapy, also known as ART. The day we start the ART, we have to also control the opportunistic infections running in the body. With the passage of time, he or she get totally cured off from the opportunistic infection. However, his HIV suppressed to a minimal level so that he or she can have the good life. So today we have discussed about the HIV or AIDS. What is HIV? What are its routes of transmission? And how can we prevent it? Or last, how can we treat it? So the last and final message from here is there is a treatment available for HIV. Patients who is being diagnosed with HIV positivity, they have to consult their physician, get their blood tested for further opportunistic infection, and then finally have to start their antiretroviral therapy as soon as possible. Stay safe, stay healthy, and stay informed. In case you are having the symptoms suggestive of HIV or AIDS, please do not delay. Seek your primary physician consultation at the earliest.